The first thing is that we need to look at is that the INBDE is a new exam, okay? And because it's a new exam, there's going to be a limited amount of information available for that exam. Now, before, if you think about it, the NBDE 1 and the NBDE 2 had a lot of remembered questions on Facebook and other areas. The new INBDE is going to be limited in the information that's available on the internet. The second thing is that the INBDE, or the Joint Commission that's actually working to put the INBDE together, is still having to work out some of the logistics, such as the fees. The actual fee schedule was supposed to be released December 2019, and we contacted them on yesterday, and they indicated that that fee schedule would probably be released at the end of February 2020. The next thing that we need to look at is the number of questions on the exam. So the number of questions has been set at 500. Well, what does that mean? Typically, with the NBDE 1, you expected to see 400 questions. So now you're going to look at having to have more endurance in terms of how you actually prepare for the exam. So in addition to preparing for the content, you're also going to have to prepare your endurance to sit for that amount of time to take the test. Now, what does this new INBDE mean for foreign trained dentists? Well, and not so much just foreign trained dentists, but anyone where English is the second language. In addition to understanding like what's actually on the exam, understanding the content, you're now going to have to apply critical thinking skills to those questions. So they're going to actually add another layer of difficulty to make sure that people do not memorize questions. Now, this is one of the things that the Joint Commission was trying to get away from, because they noticed that a lot of dentists were basically memorizing questions from old exams, and then they would pass. So now what they're going to do is they're going to create questions or answer choices that they have what we call best responses. A best response means that you can have two answer choices that are correct, but one is more correct than the other. That means whenever you are preparing for the INBDE, not only are you going to have to understand the content, but you're going to have to understand how one answer is better than the other. So that's one of the things that are going to be a little different from the NBDE 1 and NBDE 2. The other thing that they're going to be doing is removing answers that are distinctly different from one another. For instance, if you had an answer choice A that said pupil constriction and an answer choice D said pupil dilation, because in the past, because both of these answers are distinctly different, there was a 90% chance that one of them was correct. So what the new INBDE is going to do is remove those type of distinct differences. So that way, again, you don't have a test-taking advantage. The test basically will consist of those 500 questions, and they will be about a minute or less for you to respond. So you're going to have to really be able to read the question quickly, determine what they're asking, critically think it, and then pick the right answer. Now, the new INBDE is going to have some items that were not on NBDE 1 or NBDE 2, such as biophysics, genetics, craniofacial biology, public health, sociology, psychology, geriatric dentistry, statistics, and evidence-based dentistry and research. Now, a lot of these things you may have seen touched on in NBDE 1 or 2, but some of these things you may have never seen. For instance, statistics. So the kind of questions they may ask you about are things related to sensitivity versus specificity. So whenever we're talking about a drug, whenever we're talking about a test, you may look at whether, say, a drug or a particular antibiotic or something is sensitive, right? Versus specific, okay? So these are things that if you're not familiar with, you must be familiar with these for the new INBDE exam. Now, they're going to break this new INBDE exam into what they call foundational knowledge areas, such as FK1, which is basically your molecular, that's like your DNA, your RNA, the biochemical cellular relationships when you're talking about different things in terms of understanding how glucose plays a role in the cell, how it's metabolized through glycolysis and the Krebs cycle. So you're still going to have to understand those basic science topics. And so becoming familiar with FK1 through FK10 is going to be very, very important. Now, the behavioral sciences, the ethics and jurisprudence, these are things, ethics and jurisprudence, you have seen those touched on in MDE 2. The behavioral sciences, like the psych, social things, were not heavily tested on NBDE 1 and 2, but they will be tested on the INBDE. So having a good foundation of that is going to be important. Now, the area, I guess, you had to look at it and say, okay, which foundational knowledge area is the most important? If you look here, all of these are pretty equally distributed, right? All of them kind of range around the 10% range. Only this foundational knowledge 1, which is basically the molecular, biochemical, and systems, is a little bit higher. So that's knowing your cardiovascular system, knowing your the nervous system and things like that. So that's going to be important for you to understand, okay? All right, and the domain of dentistry is broken into 3 areas: the diagnosis and treatment planning, oral health management, and practice and profession. These are the 3 areas of the domain of dentistry that will go in line with those foundational knowledge areas. So I know you're thinking, okay, all of that is bad news. So what's the good news? Well, the good news is that, thank goodness, this is only 1 exam. Okay, so you don't have to spend your entire year preparing for 2 exams. This is only 1 exam. And MDI Prep is going to be here to help you. That's the good news. Now, what makes MDI Prep good? I mean, what have we done in the past? Well, in the past, over 95% of our students have passed the NBDE on the first exam, on the first attempt. So our old syllabus basically consisted of biochemistry, microbiology, pathology, histo, and dental anatomy. The new syllabus will consist of all of those things, in addition to all of the things that you see on NBDE 2, the endodontics, the oral diagnosis, all the way down to prosthodontics. So everything that you see here and everything that you saw on the NBDE 1 in our syllabus will still be covered, but now we're going to cover it in a more integrated approach. And the reason that we're doing that is because of what our director of the INBDE is Dr. Young. And Dr. Young has gone through some extensive training in preparing for the new INBDE exam. And he's also made sure that all of the instructors are also trained on how to prepare our students for the new INBDE. Now, what makes our instructors unique here at MDI Prep is that all of our INBDE dental instructors, all of them are U.S. trained dentists, and they're all affiliated with U.S. dental schools. Wow. So why is that important? That's important because a lot of times when information about the INBD or new exams are passed, they go through the dental schools first. And so once the dental school, and they basically do that so it helps better prepare their dental students. So now that these instructors are affiliated with the dental schools, they'll be able to better equip you to prepare for the INBDE. Okay. Now, what is that going to cost? So before, our level 3 guaranteed pass program at NBDE 1 and NBDE 2 was $2,500 each. So if you were going to do NBDE 1, then take the NBDE 2, and you were going to do the level 3 guaranteed pass, you would have ended up paying a total of $5,000 for both of those exam preparation courses. With the one exam, there's a total cost of $3,200. So that's good news in the sense that you're saving money on how you're preparing for the actual exam. The exam itself is going to be a lot of what we call patient boxes. These, if you remember the testlets for the INBDE, these are going to be very similar to the testlets with a little difference. With the testlets, you may have had 10 questions associated with one testlet. With the new patient box on the INBDE, you're going to maybe have about 3 or 4 questions associated with the different patient boxes, okay? Now, what are our recommendations? Our recommendations are that you take the INBDE 1, if possible. Take the INBDE 1 before May 31st, 2020. Now, I know what you're saying. Some of you are saying, wait a minute, that's too soon. I don't think I'll be prepared. So we have a class for INBDE 1 that is starting this week. All right, it starts February the 18th is our orientation. The actual class starts on Monday, the following Monday after February the 18th. The other thing that we're going to have is we're going to have what we call an intensive 1-month INBDE 1 crash course. That's going to start on April 1st, 2020. This is going to go for 1 month. This will give you the best advantage at passing the INBDE 1. Now, why is that important? Well, the thing that you should think about is if you can take the INBDE 1 and successfully pass it, you have until 2022 to take the INBDE 2 and pass it, because the INBDE 2 will stop after 2022. So our recommendation is to take the INBDE 1 before May 31st, take the INBDE 2 after September 1st, 2020. Now, there is a reason that you want to take the INBDE 2 after September 1st. And if you are interested in knowing why, then we recommend that you give us a call. So if you need any guidance, if there's something that we said that you may not understand, give us a call at 1-888-827-9881 or email us at admin@mdiprep.org. Our website is www.mdiprep.online. The key thing to remember is that you have worked very hard to become a dentist, and your goal of actually practicing is going to be determined by how you perform on the INBDE. You will pass that